Hey everyone, this video will speak about importance of literature review. Importance of literature review. Research is done in order to inform people about new knowledge or discovery, but one cannot accept that people will believe whatever is presented in the research project unless it is supported by other researchers on the same topic. It also proves that the researcher is not writing about any random subject, but many others have also communicated and given valuable input about the same topic. Review plays an important role in this aspect. Literature review is important for establishing a link between the researches that have been done already and the relationship with the proposed study. It also informs the reader about the aspect of the topic that have been explored by other researchers and that need to be studied further. A good researcher usually does extensive literature review which helps avoid duplication of work. In case of replication, it provides an option for modifying the research problem with new perspective in terms of setting, sampling technique, population, research design and so forth, thus making it more valuable. When the literature review is performed sincerely and honestly, it yields a lot of information, but it may not be possible to include everything in the study. To trace the intellectual progression or the recent advances related to the topic, depending on the situation, literature review also helps to evaluate the sources and advise the reader on the most pertinent or relevant sources. Literature review always seeks to summarize the available literature on any one topic with different perspectives. It helps the reader to gain knowledge without reviewing the individual studies. This is very important as there is tremendous amount of literature available and it is not feasible for every healthcare professional to read and assimilate all informations. Usually, by the end of the literature review, the researcher can identify the gaps related to the topic and the significance of undertaking the study. For example, if someone wants to assess the perception of children towards chronic illness about death, there may be very few studies and almost none in the Indian scenario. Lastly, review of literature plays an important role in identifying the difference of opinion and contradictory findings and explanation given by various researchers related to the topic. For example, if anyone interested in evaluating the effects of traditional medicines on blood sugar level among patients with diabetes mellitus, a researcher may get the information from the various sources that may reveal similar or exactly opposite findings. In such situation, a review will provide a guideline for selecting appropriate medicines that can be used in the proposed study.